Understanding and managing sickle cell disease, causes, symptoms, diagnosis, and treatment options. Sickle cell disease is most common among people of African descent but also occurs in people of Hispanic, Middle Eastern, and Mediterranean ancestry. Sickle cell disease is an inherited blood disorder that affects the production of hemoglobin, a protein in red blood cells that carries oxygen throughout the body. People with sickle cell disease produce an abnormal form of hemoglobin, called hemoglobin S, which can cause red blood cells to become stiff and form a crescent or sickle shape. These sickle-shaped cells can become trapped in small blood vessels, leading to a range of complications. Classification and types. Sickle cell disease is classified into different types based on the type of hemoglobin produced. The most common types are sickle cell anemia, HBSS. This is the most severe form of sickle cell disease and occurs when a person inherits 2 copies of the sickle cell gene. Sickle hemoglobin C disease, HBSC. This occurs when a person inherits 1 sickle cell gene and 1 gene for another abnormal hemoglobin called hemoglobin C. Sickle beta thalassemia, HBS/beta 0 or HBS/beta+. This occurs when a person inherits 1 sickle cell gene and 1 gene for beta thalassemia, another type of inherited anemia. Signs and symptoms. The signs and symptoms of sickle cell disease can vary from person to person and can include pain crises. This is the most common symptom of sickle cell disease and can occur anywhere in the body, that can last for hours or days. Anemia. Symptoms of anemia can include fatigue, weakness, and shortness of breath. Infections. People may be more susceptible to infections, particularly those caused by bacteria such as Streptococcus pneumoniae. Organ damage. Sickle cell disease can damage various organs, including the spleen, kidneys, lungs, and eyes. Delayed growth and development. Children with sickle cell disease may experience delayed growth and development. Vision problems. Sickle cell disease can cause damage to the blood vessels in the eyes, leading to vision problems. Leg ulcers. Sickle cell disease can cause leg ulcers that are slow to heal. Complications. Stroke. Sickle cell disease can increase the risk of stroke, particularly in children. Acute chest syndrome. This is a life-threatening condition that can occur when sickle cells block blood vessels in the lungs. Eye problems. Sickle cell disease can damage the blood vessels in the eyes, leading to vision problems. Priapism. This is a painful condition that occurs when blood flow is blocked. Gallstones. Sickle cell disease can increase the risk of gallstones. Pulmonary hypertension. This is a type of high blood pressure that affects the lungs and can be a complication of sickle cell disease. Diagnosis. Sickle cell disease can be diagnosed through a blood test that detects the presence of hemoglobin S like HB electrophoresis. Testing can be done shortly after birth through newborn screening programs or later in life if symptoms occur. Medical management to prevent and manage complications. There is currently no cure for sickle cell disease. Treatment options may include following: regular checkups. Regular checkups with a healthcare provider can help identify and manage complications of sickle cell disease. Vaccinations. People with sickle cell disease should receive vaccinations to prevent infections, including pneumococcal and influenza vaccines. Hydroxyurea. This medication can reduce the frequency and severity of pain crises and may improve overall health. Blood transfusions. Blood transfusions can help prevent complications of sickle cell disease, such as stroke and acute chest syndrome. Pain management. Pain management is an important part of sickle cell disease management, and may include medications, hydration, and other therapies. Education and counseling. Education and counseling can help people with sickle cell disease and their families learn about the condition and how to manage it effectively. Gene therapy and stem cell transplant. These are new and promising treatments for sickle cell disease, but are still in development and not widely available. Prevention. There is no known way to prevent sickle cell disease, as it is an inherited disorder. However, genetic counseling and testing can help individuals understand their risk of having a child with sickle cell disease and make informed decisions about family planning. Pregnancy. Women with sickle cell disease can have safe pregnancies, but it requires careful management and monitoring. Women with sickle cell disease may be at increased risk of complications during pregnancy, including preeclampsia, preterm labor, and low birth weight. There are several other ways to help manage sickle cell disease and improve quality of life for people with the condition. Hydration. Staying well hydrated is important for people with sickle cell disease, as dehydration can trigger a pain crisis. Avoiding triggers. Certain factors can trigger a pain crisis, such as cold weather, stress, and physical exertion. Nutrition. A healthy diet can help support overall health and reduce the risk of complications. People with sickle cell disease should aim to eat a balanced diet with plenty of fruits, vegetables, whole grains, and lean protein. Exercise. Regular exercise can help improve overall health and reduce the risk of complications. However, people with sickle cell disease should talk to their healthcare provider before starting a new exercise program. Emotional support. Living with sickle cell disease can be challenging, both physically and emotionally. Seeking emotional support from family, friends, or a mental health professional can help people with sickle cell disease cope with the challenges of the condition. Overall, managing sickle cell disease requires a multifaceted approach that includes ongoing medical care, lifestyle changes, and emotional support. With proper management, people with sickle cell disease can live longer, healthier lives.